Visit licensuraexams.com and try our samples completely free of charge.
All right, you studious therapist, it's great that by choice you take time out of your busy schedule to squeeze in just a little more knowledge to expand your horizons. And perhaps pass your licensing exam by picking up that extra point that will push you over the top at the same time. Good show. Remember, you are passing the exam right now, and your future licensed self will thank your present self for your undying devotion and enthusiasm with your studying process.
Ever wonder why your client bounces between crisis and therapy, but never quite finds stable ground? Sometimes it's not the treatment that's off, it's the level of care itself. Today, we're breaking down the continuum of care, what it really means to match someone's clinical needs with the right setting, and why that makes all the difference.
We'll explain how this spectrum works, look at real-world signs when the fit isn't right, and clear up how tools like the ASAM criteria and locus guide these decisions. 2 concepts you need to know for your exam.
We'll also look at which diagnoses most often drive placement, why systems factors can override the best clinical intentions, and share practical strategies you can use right away.
When people hear continuum of care, they often picture a straight line from crisis to stability. But it's really more like a set of rungs on a ladder, ranging from inpatient hospitalization down to peer support groups.
And the key is that movement isn't a one-way street, Eric. Someone might start with 2 4-hour care and gradually step down or switch levels if their situation changes. The whole point is matching support to the client's current needs, not just what's available nearby.
And that's where frameworks like the ASAM for substance use and locus for mental health step in. Both help you figure out, in a structured way, where someone fits on that spectrum at any given moment.
That flexibility is crucial. Otherwise, people get stuck in the wrong spot, which only leads to frustration for you and your client.
I think you've experienced this one. A client who's supposedly receiving the right kind of placement but keeps ending up in crisis. It's a clear sign that maybe outpatient therapy isn't enough for him.
Totally. Then on the flip side, you'll see a client placed in an intensive program after a brief crisis, and suddenly they're disengaged or acting resistant. It's not always defiance. It could be that the setting just doesn't fit their needs.
Behavior at the story. When a client is in either constant distress or checked out, it's a sign it's time to reassess their placement rather than blaming the client.
You got to remember, some diagnoses almost always raise questions about level of care, like schizophrenia, severe bipolar disorder, or substance use disorders. But it's not just about the DSM label.
For sure. Factors such as a client's day-to-day impairment, support system, and specific risks are just as critical. And when co-occurring disorders come into play, things can go south really fast.
And your favorite type of clients who exhibit dual diagnosis often need specialized treatment that isn't always available at every level. So placement becomes even more nuanced.
Nuanced, you say, Stacy? How about next to impossible? Anyway, let's look at some assessment tools. The ASAM criteria is basically the gold standard for substance use. It looks at 6 dimensions from withdrawal risk to recovery environment. And, by the way, make a note of that for your licensing exam.
And for mental health issues, Locus does similar work. Most therapists use these alongside assessments like the Columbia Suicide Severity Rating Scale or the GAF, especially when insurance wants more justification for placement.
So, it's really about building a multidimensional picture for not only insurance, but primarily for your client, not just ticking boxes, but documenting what's actually going on.
It's unbelievable how placement decisions are usually decided in a vacuum. Family involvement, insurance rules, and even geography should shape what's possible for a client.
That's where systems theory comes in, with the concept that recovery isn't about keeping someone in the highest level forever. The goal that you have with your client is to help them move toward greater independence and integration into the community.
And to do that, you've got to learn the language of medical necessity. since managed care realities are always in the background.
So, what actually works in practice? A thorough biopsychosocial assessment at intake is imperative, and regularly updating it helps you from missing crucial changes and may keep you out of litigation.
Collaborative decision making is also huge. When clients help choose their level of care, they're way more likely to stick with it. And warm handoffs where you stay with your client and connect them to the next provider will make all the difference during transitions.
Plus, a little psychoeducation goes a long way. When people understand what each level involves, they're less likely to be scared or resistant to moving up or down the continuum.
So let's recap. The continuum of care spans from intensive inpatient to peer support, tailoring support to client needs using tools like ASAM and Locus. Incorrect placement can lead to creases or disengagement. Common placement drivers include severe mood, psychotic, and substance use disorders, often with co occurring diagnoses. Placement considers more than diagnosis, it's also dependent on the client's functioning, external supports, and overall risk factors. Effective care relies on thorough assessments, collaborative planning, and ongoing review to promote independence.
Again, to make sure we're on the same page. First, the right level of care is all about clinical fit, not just diagnosis or availability. Second, practical tools like ASAM and Locus help guide decisions, but your ongoing assessment is just as vital. Third, never forget the impact of systems, insurance, family, and geography often shape what's actually possible, so flexibility matters. If you do one thing after this episode, start updating your biopsychosocials regularly and talk openly with clients about level changes.
So, when you see the words continuum of care on your exam, the three takeaways should come to mind. Thanks for joining Eric and me today. Keep studying a little each day, feeling that positive vibe that you are passing the exam right now. And remember, it's in there.